see her. Hi, Adrian.
Hi.
How are you today?
Is that Byron?
Yeah, we got Byron today.
Hi.
Class number 4.
Oh, how come I don't see her over here?
There she is. Okay, so we're gonna start with a little neck stretch, and it's for these muscles in the front of our neck, the sternocleidomastoid and your scalenes here.
By the way, my neck and shoulders feel much less tight than they did last week.
Good, awesome, good.
Yeah, I've been working really hard.
Great job, awesome. So what we're gonna do first is you can put your hand on your collarbone if you want, or you can rest it. You're gonna tuck your chin in, tilt your head to one side, and then turn your eyes away or turn your head away. So you're stretching the side that is rotated. And hold that. Good. Keep the chin tucked. You can kind of maneuver it a little bit till you feel more of a stretch. Sometimes you have to bring the chin in a little bit more. Good. And then come back to the center. And then we'll do the other side. So I'm just going to put my hand on my collarbone, tuck my chin, tilt my head away, and then rotate my head in that direction.
Oh, that really hurts.
Yeah, so you can ease off of that. If
well,
it hurts,
I just don't go very far.
yeah, just go to your tolerance.
But this move has been bothering me for years.
Yeah, a lot of us have a lot of tightness in these anterior neck muscles. Yeah, so it's pretty shocking when you get in there.
Yeah. What's the point of putting our hand on our collarbone?
So the scalene muscles, which are kind of in this area, they attach to the collarbone. So they go from your neck to your collarbone. So when you put your hand on the collarbone, it's sort of, it anchors, thank you. It anchors them down so that you're getting like a little tactile stretch that way.
And
one more.
When you don't use your fingers on your chin, how do you tell when your chin is back?
Yeah.
Is it kind of like when your stomach is in?
Exactly. Yeah.
Okay.
So the neck flexors are kind of like the abdominals of your neck, right? They're the ones that like stabilize and hold your head in that neutral position. So if you don't use your fingers as a cue, you kind of just make sort of like a little double chin. And you can sometimes, if you're very tight, you can feel the back of your neck stretching out a little bit, like this part right here. I am tight, so when I do that motion, even without my fingers, I feel it stretching back there. So that's another.
What I've been doing today is I hold in my stomach, and that kind of reinforces this.
Perfect. Yeah, perfect. They all go together. It's all synergistic.
I've never done it, so I'm just kind of ad-libbing.
It's perfect. So one more time, we're gonna do one more stretch. We're gonna tuck our chin. We're gonna tilt our head to one side, and then we're gonna rotate to that same side.
I'm going this way.
Yeah. For me, it's my left, but whichever side you want to start with. Good, and then we'll come back, and then we're gonna do our other side one more time. So anchoring our shoulder, our clavicle, tilting away, tucking our chin, and rotating up. This one's for me tighter.
Yeah, me too.
No? Yeah, sometimes you have a bad side.
It's been bad for years.
Yeah, it's usually not a new thing. It's something, you know.
It's probably not going to get too much better.
Nope, but we just want to maximize what we can do. Our best.
Well, I'm all about maintenance now.
There you go.
You hit a certain age and it's all about maintenance.
Wonderful. Okay, great. So let's come on back. Okay, so the next thing we're going to do is a little bit of a wall walk using our scapular muscles, our serratus, like we used to do with the pinches in and out. And we need a wall and we need a band. So I'm going to angle it this way. We're going to use our column here. And then Byron's going to grab a band. So Byron, take the band in both hands and just sort of press out. And your forearms, the pinky side, is going to be against the wall. There you go.
That.
Yep, that's good. So he's gonna anchor his elbows, pinky to elbow against the wall. He's gonna press out into his band, so he's getting a little external rotation moment. He's gonna anchor his shoulder blades against his back. And then little by little, he's gonna walk his forearms up the wall, keeping that tension.
And should my arms be in like away from my body?
Yes, yes. So it's gonna be about, you're gonna start at about 90 degrees or like at shoulder height, okay?
Mm-hmm.
You're gonna press into your band so you get an external rotation moment, right? And then just little steps up, maybe 1, 2, 3, and then little steps down.
Oh, that feels so good.
Good. I like having a little tactile cue with the wall. Sometimes it just brings it home a little bit.
Oh, I definitely need it.
Wonderful. So keep that nice upright posture. The shoulder blades keep anchoring against your back. Walking up slowly.
I feel like this works my rotator cuff and my pectorals.
It does. It works the rotator cuff for sure. It kind of opens the pectorals a little bit.
Yeah, and my shoulder blades.
Right, and then it's going to work that muscle underneath your shoulder blade that attaches to your rib cage, serratus anterior muscle. So it works a lot of things together. Good, and we're slowly walking down. Good, and we're going to do 5 more little walks. So like 1, 2, 3 up, 1, 2, 3 down. Perfect. Keep that right there. Good, walk it up. And walk it down.
Oh,
get up. Couple more if you can.
It's really tiring.
Yeah, it's surprisingly tiring. And come on down, and then we're just gonna do 1 more little wall walk.
Is that for strengthening?
It is, yeah. When you're using the band, you're getting the rotator cuff to activate. So yeah, it actually is a strengthening exercise. Good. And then come on down, Byron, that's your last one. Okay, great. All right, so we did some little wall walks. We stretched our necks a little bit.
Oh, before I forget, Mari, I have a question on one of the band exercises.
Okay.
Okay. So it's the one with the door.
Okay.
When you go this way.
External rotation. Is this the rotator cuff with the elbow in by the side?
No, it's the elbow where you kind of rotator cuff, but you kind of go out.
Okay. Is it on the sheet this week?
I can't remember.
Okay.
But we did it last week.
We did it last week. Let me think.
So my question is, when I'm doing this,
yeah,
does my elbow go out like this, or should I go more like this?
No, I think it's close to the body, and I think you're talking about the rowing exercise where you have both.
No, not the rowing. You know, this one. There's this.
Yeah.
And then there's this.
Right.
And for this one, this is the rotator cuff that was torn.
Right.
It's better now. But when I do this exercise, I feel a little pain.
Yeah.
I'm just wondering if my alignment.
Yeah. I think in that one though, Adrian, I think that you're going to do external rotation, which means you're going to put your towel roll under your elbow. So it's going to anchor to your side, right? Back up a little bit. And then say I've got, my anchor over here. That's this guy where you're rotating away with your elbow anchored at your side.
Yeah, that feels much better.
That's right. Yeah. So the elbow is going to stay by your side for that one.
Mm-hmm.
But I'm going to show you, and actually I'm going to show you right now sort of a progression of that one.
Okay.
But I'm going to show you in a way that I don't think is going to be pinchy up here, but
okay.
we shall see. Okay? So we're gonna take our band, we're gonna anchor it. Let's see where we can put this. Let's come over here. We're gonna tie this onto our little post here. All right. So you only need one end of it. You don't need both, but I'm just gonna tie the knot here. And then on this one, because it's a combination move, I'm not gonna give Byron the towel roll because he's gonna take the end here. He's gonna squeeze his shoulder blades together. He's gonna rotate out, and then he's gonna punch it away. So he never goes up above the shoulder, it stays the shoulder height. Then he brings it back in, and then he rotates back to neutral.
Wow, that, ugh.
So it's in pieces, which should make it a little easier, although it is a progression of just the external rotation. So his elbow's in, he squeezes his shoulder blade, he rotates out, he punches away, he brings the elbow back in, and he rotates back.
So,
Okay, so let me watch you. Rotate out, punch it away. Yes, bring the elbow back and rotate back in.
Okay,
Yeah.
I had to loosen my band.
Right, you can adjust the length of the band to make it lighter as much as you need to. And the key while you're doing this is that you're constantly squeezing your shoulder blades together in the back, okay? So the chest is open and the blade is anchored, and you're just doing your rotation and your punch out.
Okay, now Mari, because of how my the room I'm in is laid out, when I punch out, I'm on a diagonal.
You're on a diagonal. That's okay.
I can't go straight. Well, actually, I could go straight.
Okay. Anywhere in front of the shoulder joint, like, okay, so this is straight out. You can be slightly in the plane of the scapula in front. That's perfectly safe. So, and you're still getting the work. So that's okay. If you're not able to reach straight out to the side, you can come at a slight diagonal. You're still working the right muscles.
Okay.
How are you doing, Byron?
Okay.
Okay.
A little tired. Can I switch sides?
Yeah, let's go ahead and switch sides. Awesome. So now we're going to switch sides, and I'm going to turn this so that you can be seen. Okay, so we're just going to switch sides. So the elbow starts in. He's going to squeeze his blades together. He's going to rotate out to the side. He's going to punch away from his body. He'll bring the elbow back into his side, and then he'll rotate back in. Good. So rotating out, punch away, bring it back in with the elbow, and rotate back. Good. So is this your stronger side, Adrian?
Yeah.
Yeah, much better. And punch away.
Definitely.
This is Byron's weaker side. Look at his shoulder.
Yeah.
So watch for this. I'm going to have him do it, and I'll just point it out. Okay, rotate out. So that looks good. He's going to punch out, and you see this comes up a little bit. Pull this down, Byron, there. So that's probably all he can do because he just doesn't have the strength to keep it anchored.
Yeah.
So if you have to cut the movement short, that's fine, as long as your form is right. Let's just do a few more. Keep squeezing that blade. It gives you power. Punch it away just to where you can without hiking your shoulder. Good. Bring it back in and rotate. Good. Punch it away. And back in. And one more time. Keep the blade squeezed. Good job, everyone. Perfect. Okay, good. And then every time I do rotator cuff, I just kind of like to roll it around a little bit just to get some blood flow.
Yeah.
Sometimes it gets really tight, right? Yeah. Okay. So then our next exercise, we're going to do, again, retraction of our shoulder blade and a little bit of a tricep press. So we're going to do another combination move here. So I'm going to grab a chair, or the back of the chair, for Byron. Let's see. angle this down. So you're going to grab the back of the chair. Actually, let's do it this way. You just want to support, pick an arm that you're going to start with. You're going to support yourself either on a table or back of chair. You're going to have your free weight in the free hand. He's going to kind of hinge at his hips and bend over the chair. He's going to use his shoulder blade to pull his elbow in by his trunk and retract the blade. And then he's just going to extend his elbow out. So he's going to do a tricep kickback. Yeah. Oh. Good. And then bend and then bring the whole thing back down. Good. So you retract the shoulder blade, bring the elbow in by your side, extend the elbow, bend the elbow, bring the arm back down. Good. So retract your blade, elbow by your side, straighten your elbow, bend your elbow, and back down. Good. Keep going. Retract your blade, straighten the elbow, bend the elbow, and bring it back down. So retract your blade. Good. Straighten it. Perfect. Great. Let's do 5 more on this side, and then we'll switch arms. So retract the blade always comes first. Then you're going to tricep kick back, bend the elbow, and bring the arm back down. Good. Retract the blade, extend the elbow, bend it, bring it back down. 3 more to go. Retract the blade, straighten the elbow, bend it, and bring it back down. 2 more. Retract your blade, straighten, bend, and down. Last time. Retract, straighten.
Actually, I can do it without the weight.
Absolutely. You can do it without the weight, just the movement itself. Yeah. Good. Go ahead and switch sides. So we'll turn you around. Okay, we're switching arms. But yeah, you can do it without the weight. You don't need weight. So we're going to retract the blade, straighten the elbow, bend it, and bring it back down. Good.
Well, this is my better arm.
Yeah. This is your injured side, yeah?
No, this is the better side.
The better side.
The injured side, I'm not going to use the weight.
Okay. Sounds good.
Not yet. Not yet. Stronger.
Wait until you get it a little bit more capable, yeah.
Yeah.
Feels less stable.
Does it?
Yeah.
Byron's saying that this is his stronger side, but it feels less stable. That can be the case. You know, sometimes our dominant side or our stronger side, again, because we use it more, has issues.
As long as I don't get injured, I'm cool.
That is definitely not on the menu for our class.
I feel like I've had so many injuries the last few years.
Oh. Yeah, form is key. So as long as you're true to the form and you're modifying as you need to, you should be just fine.
Well, it's not the exercises, it's going out in the world.
Oh, it's everyday life.
Yeah, the world is not an accessible place.
Not as much as we'd like it to be, that's true. Okay, we got 2 more to go on this side. Pulling back, straightening out, and down 1 more time. Very good. Okay, great job, guys. So you can roll that shoulder around again, kind of pinch and retract. And then the next thing we're gonna do are T's. So we did some W's last week. We did I's. Now the T's are, the arms are gonna be away from your body. So I'm gonna have Byron sit in the chair. Although in the picture of the exercise sheet I gave you, the person's doing it over a ball. So you can do it over a ball, you can do it lying on your stomach or seated. So I'm gonna have Byron sit, and then he's gonna hinge his hips over his knees. you want the weights or, okay. So I'm gonna give him a weight in each hand, but you don't have to use weights if you don't want to. So chest over knees, Byron, get real flat. He's gonna tuck his chin. He's gonna bring his arms straight out to the side like a bird or airplane here. Good. And then he's gonna rotate so that the thumbs are up, so his joint is neutral. And then he's gonna squeeze his blades together and just hold that little T position for 10 seconds. So we're holding 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax slowly. He'll sit up, take a little moment. Good. How are you doing, Byron? Welcome to the shoulder class. All right, we're gonna do that again. So we're gonna, for Byron, he's gonna hinge at his hips and lean forward. He's gonna tuck his chin. He's gonna bring his arms out to the side in the T position. His thumbs rotate up, and then he's gonna squeeze those blades together, and he's gonna hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and slowly relax and take a break. Okay, good. Yes, it does burn.
Yeah.
Burns so good. No? All right, we have 3 more to go. So we're gonna hinge at the hips and just pitch forward. Good, we're gonna tuck that chin. The arms are gonna come out to the side in that T position. Thumbs rotate up. Squeeze your blades together and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And then with this one too, Adrian, like you were saying before, even though we're not specifically saying it, you're gonna draw in with your core muscles. So you're gonna engage your abdominals, right?
Right.
Yeah. That is key.
Yes.
All right, we've got 2 more to go. So hinging forward. Okay. Here we go. Chin is tucked, arms go out to the T, thumbs rotate up, squeeze your blades, and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Okay. Excellent. Last set coming up. Hinging forward. Chin tucks, abs on, arms to the T, thumbs rotate up, squeeze the blades together and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Good job, guys. Okay, excellent. So I will take those from you, Byron. All right, let's do a little stretching because we're
before we end, could you demonstrate the I and the W again for me?
Yeah, sure. So the I is the I is same position. You're gonna pitch forward, right, at your hips, chin tucks. Now his arms are just by his side, and then you squeeze your blades together and you hold that position. So the I is just straight arms right by your torso, and that scapular squeeze, and you hold that with the chin tuck.
And you don't want your shoulders to go up.
No, you just want to, again, retract the blades and hold that there. It's not about shoulder extension. So it's not about your arms going like way up your back.
Yeah.
They're by your side.
Okay.
Yeah. So that's the I.
That's what I wasn't sure about.
I see. Yeah. So again, this is more about your shoulder blades.
Okay.
And then the W is he's going to bend his elbows so his palms are down. So it's kind of like this position, right? But face down.
Are your elbows in your sides or out?
They are away from the sides, but they're not back here. They're just right here.
Okay.
And then in that position, same thing. He squeezes his blades together, and then he holds that. So he's not pushing his elbows back. He's just holding them at his side, and then he's squeezing his blades and holding that position.
So I guess what confuses me is where your arms are, because it's basically, it sounds like the same exercise, but just your arms are in different places.
Yes, that's true. But the position of the arms changes the difficulty. So you're still working the same muscles, but you're working them in a slightly different way, and you're challenging them in a different way.
Which one is more difficult?
The T. Which is the one we just did. And the reason is because the length of your arm, it creates more resistance or weight, right? If you add weights to that, it's even harder to maintain that position. So that's gonna be the hardest. The middle one, the middle of the road, is gonna be your W. And then the easiest is gonna be your I.
Yeah, okay, I see.
Yeah, but they all, you know, they're all slightly different. So I think there's, even though they work the same muscle groups, it's in a slightly different way. So I kind of like to mix them in.
Yeah. Would you consider those isometric?
Yes, yes and no. Yes, because you're doing a hold. No, because you are getting into a retracted position, which, so isometric is generally you're contracting a muscle, but no movement is occurring. The movement is occurring, but it's very minute. It's very small. So you're getting into that retracted position and you're holding that. So, you know, I guess once you're in that position, it's isometric, but you have to get into that position.
Okay, thank you.
Kind of yes, kind of no.
Yeah.
Sorry.
Got it.
It's like it depends. Okay, so let's do one little rotator cuff posterior shoulder stretch. And then I think I've been told that we're going to be doing another series of shoulder in all of our exercises. So we'll just continue on into the next week too. Okay. So you come on up, Byron. So what we're going to do with this one to stretch sort of the back of the cuff is we're going to take our arm across and take the other arm, just depress the shoulder or drop it down and just bring it across your body. I can't even reach because my arm's so short. So just grab onto the upper arm as best you can.
I can reach, but my arm doesn't straighten. This is as straight as I can do it. Go.
That's okay, because where we're trying to stretch is going to be this part. So it doesn't really matter what this part of your arm is doing, but you want to kind of drop it down and then just pull it across. Can you push it down with your muscle? There you go, and hold it there and just go like that. Okay, good. And then we'll take that one down, and then we're going to come across with our other arm. Same thing, drop that left shoulder, Byron, good, and then pull it across. Okay, good. And then I just do one last little rolls of the shoulder. And we're done for today.
Great. Thank you.
Good. You're welcome. So hopefully we'll see you next week then.
Okay.
Okay. Have a good week.
Bye.
Bye.
Thank you.